welcome to our channel Dentistry to the Point. This is Dr. Drumil Manek. So in our first part we discussed about the introduction, pathophysiology, Starling's law and the clinical features of heart failure. Now we are moving on to the second part of this topic, that is we'll discuss about the types of heart failure, the investigations for this condition and also the treatment modalities available for this condition. So firstly, starting with the types of heart failure. In types of heart failure we have left and right heart failure, the systolic and diastolic heart failure, high output failure or low output failure, and acute and chronic heart failure. So firstly we'll discuss about the left and right heart failure. So in left heart failure, the word itself says that कि वो left side of the heart से start हो रहा है. So you guys already know कि the left side of the heart consists of left atrium, left ventricle, the mitral valves and the aortic valves, and the right side of the heart consists of right atrium, right ventricle, tricuspid valves and the pulmonary valves. So firstly about the left heart failure, it will start from the left ventricle, that is the left ventricle is not able to pump out adequate amount of blood to the other parts of the body. So that will lead to increase in the left ventricular pressure. That increase in the left ventricular pressure will lead to increase in the pressure in the left atrium. क्या हुआ? सबसे पहले left ventricle which is not able to pump adequate amount of cardiac output, that is decreased cardiac output, that will increase the left ventricular pressure, that will in turn increase the left atrial pressure and will lead to pulmonary edema. Same goes for right ventricle. In right ventricle, same, the decreased cardiac output, that will lead to increase in the right ventricular pressure. That pressure will be transferred to the right atrium, which will also lead to increase in the right atrial pressure and lead to increased JVP, that is jugular venous pressure. The pressure in the jugular veins will increase, congestive hepatomegaly, peripheral edema and ascites. So this was left and right heart failure. In the same manner it can also occur as biventricular heart failure. That means it will start from one ventricle and it will go on affecting to the other ventricle. So that it starts from the left ventricle, it will go on affecting to the right ventricle. In the same way, next we'll move on to the systolic and the diastolic heart failure. In systolic heart failure, it is due to poor myocardial contractility. The word systolic means contraction, so the myocardial contractility is not proper, so it will lead to systolic heart failure. If the poor ventricular filling is present, that means कि जो भी ventricles है उनका relaxation या diastole सही से नहीं हो रहा है, तो that will lead to poor ventricular filling, which will lead to diastolic heart failure. Next is high output failure, that is due to more amount of cardiac output, that is the state in which the heart is pumping out more amount of blood. So we cannot directly call it as high output failure, but it is a misnomer. We can say it as high output state of the heart. It can also be as low output failure in which the heart is not able to pump out adequate amount of blood. So we call it as low output failure. And lastly we have acute and chronic heart failure. So in acute heart failure, it is due to any condition like myocardial infarction that is very acutely occurring, or any valvular heart disease, any disease of the valves of the heart which is chronic in condition, which is occurring slowly, it is not attacking directly in short span of time. So this is acute and chronic heart failure. These were the types of heart failure: left and right, systolic, diastolic, high and low output, and acute and chronic heart failure. Now next we'll discuss about the investigations and treatment of heart failure. So next, moving on to the investigations of heart failure. In the investigations of heart failure, we'll carry out two things in main, that is the ECG, which we call it as electrocardiogram, and second is the chest X-ray. Along with this two tests, we'll also carry serum urea, electrolytes, thyroid function tests and etc. So these two are the main things which will be carried out in the patient of heart failure. Firstly, discussing about the ECG. ECG will detect any of arrhythmia, that is arrhythmic contraction of heart, ventricular hypertrophy or myocardial infarction. If we do the ECG of that patient, we can detect any of this from which is present, that is arrhythmia, ventricular hypertrophy and myocardial infarction. Now next, moving on to the chest X-ray. In the chest X-ray, we'll see a few things which are important to heart failure point of view. That is, first is rise in the pulmonary venous pressure. जो भी pulmonary veins में pressure rise होगा, that will be due to increase. Firstly कहाँ से start होगा, left ventricular pressure will increase, जैसे अपन ने पढ़ा था types of heart failure में, then it will move to left atrium, then increasing the pulmonary venous pressure and then pulmonary edema. So in same way, rise in the pulmonary venous pressure seen as abnormal distension of pulmonary veins in the upper lobe of the lung. कहाँ दिखेगा? In the upper lobe of the lung you will see abnormal distensions of pulmonary vein. जो भी pulmonary veins रहेगी वो abnormally distended दिखेगी आपको upper lobe में. Along with that, the vascularity of lungs increases. जो भी vascularity रहेगी lungs की, that is gonna increase. In this condition, the left and the right pulmonary arteries dilate. जो भी left and right pulmonary arteries है, that are going to dilate. The dilated lymphatics are also seen. The dilated hilar lymphatics, जो भी hilar lymphatics होंगे वो भी dilated दिखेंगे आपको. And lastly, that is the curly B lines. Curly B lines are the radiopaque lines which occur due to interstitial edema and the dilated lymphatics. जो भी interstitial edema होगा और dilated lymphatics होगा, उसके कारण there will be presence of radiopaque lines present at the costophrenic angle. Costophrenic angle क्या है? Costophrenic angle is the angle at which the diaphragm and the lungs meet at the corner. That angle is known as costophrenic angle. Near that angle we are going to see the curly B lines, which are the radiopaque lines seen due to interstitial edema and dilated lymphatics. And lastly, we will see elevated amounts of BNP, that is brain natriuretic peptide. So this is an important marker in the patients of heart failure. This is going to be elevated. So this will also help to diagnose that the patient is facing heart failure. So these are the investigations which are carried out, that is ECG, chest X-ray, BNP, and along with this I told you serum urea, blood electrolytes and thyroid function tests are also carried out. You just need to remember curly B lines at costophrenic angle, which are due to interstitial edema and dilated lymphatics. Next we'll discuss about the treatment of heart failure.